Well, good afternoon and welcome to our Kauai Health bi-weekly webinar. Today is Thursday, May 20th. My name is Deborah Volison and I'm the Director of Community Engagement here at Kauai Health. And we have a lot of exciting things happening at Kauai Health, and we are so glad that you are able to take the time and meet with us to go over all of those exciting things. Since COVID is continuing to decline, we're going to talk about those numbers because it's still important. We're still experiencing it. But we're also going to talk a little bit about other things that are going on. And I'm joined today by our CEO, Gary Herbst. And Gary, our last 2 weeks really have been filled with a lot of activities. We had the nursing week, we had hospital week, and we rounded off hospital week with the Starlight Awards.
Right.
And so you were serving lunches, you were serving breakfast, out greeting people, and then giving awards. So what's something that just jumps to the top of your mind? What are some highlights?
Well, actually, the 2 weeks that you just described, the first week was National Nurses Week. So not just here at Kauai Health or Visalia, but literally across the entire nation, all hospitals giving honor and tribute and celebration to our incredible nurses who have exhibited some of the most unimaginable courage over this last 15 months of this pandemic. And it was it was refreshing. It was really wonderful that we could take just a moment, out of our incredibly hectic professional lives here at Kauai to, again, honor our nurses. We had activities going on every day, serving breakfast, serving lunches. We did Superhero Day where we dressed up and wore our favorite superhero outfits and capes, and we gave away lots of different gift baskets that all the departments across the organization donated to our nurses. It's Florence Nightingale's birthday.
So did you get to spend any time with the big Florence Nightingale?
I did not. But our nurses, I tell you, they have a lot of fun. So they ordered all of these kind of cardboard cutouts, some of them life-size, of Florence Nightingale, who wasn't the most colorful individual. I guess apparently black maybe was her favorite color.
We couldn't find anywhere where she was smiling.
No.
So she's kind of scary.
Right, yes. But the more I've learned is that back in that period, nobody smiled in photographs. That I guess that was
the thing.
Forbidden, yeah. But everybody got to take their pictures with Florence, dressed in all different kinds of outfits. And so I hope our nurses had a wonderful time and again, letting us honor and celebrate them. And then the following week was National Hospital Week. Again, hospitals across the country celebrating themselves, but really celebrating all of the employees of the organization, our 5,100 employees, but also celebrating our physicians, our advanced practice providers, all of our volunteers. Again, we had activities occurring every day. Deb and I spent one of the lunch hours. Daniel, over on the West Campus, where we were doing an indoor picnic. And so we did hot dogs with chili beans and the whole works.
They were gourmet hot dogs.
Gourmet hot dogs. Except the little veggie dogs didn't look very gourmet-ish.
No, I felt sorry for anybody who took one of those.
Yeah. But again, it was a lot of fun. Just having the leaders of our organization get the opportunity to serve our staff. And then, as Deb mentioned, kind of culminated Thursday night in our third annual Starlight Awards ceremony. And that's where we honor and recognize and again celebrate the incredible leadership and service excellence demonstrated by many of our employees that were kind of singled out and recognized and received awards our physicians of the year, our residents of the year, our nurses of the year, what we call our partners in care, so our housekeepers and our dietary workers and laundry and virtually every department across the organization that supports patient care in some manner. And then it culminated that evening, at the end of the evening, announcing our Employee of the Year, who is Molly Niederreiter. Molly is a physical therapist by training, and we just announced this week that Molly is our new director of rehabilitation services.
I would I'd like to think that award catapulted
kind of pushed her.
into that.
Yeah, it certainly made her stand out among all the candidates. But we're going to miss Lisa Harold, who has been our director for so long and just an incredible leader. She leaves behind just a rock solid service and group of employees that Molly will now get to lead, and so we're excited that night. We surprised Molly. We lured her under false pretenses to the event.
And that's amazing. I can't believe we.
I know.
got a
Well, we
surprise,
also got her husband there.
Yes, we did.
And some inventive stories to bring them there and not cause them to be overly suspicious. But,
right. And our very own Daniel.
Yes.
Received an award for
Daniel
an inspirational leader.
Inspirational leader, yes.
And, the viewers never see Daniel because he's the one making sure the webinar our leadership webinars, any webinar that we do here at Kauai Health, Daniel is somehow involved in making sure that it works.
Maybe the next broadcast we have Maria and
Daniel come over and we'll ask them questions.
Yeah, there you go. Just kind
That's a good idea.
of mix it up a little.
Yeah.
Now, for Maria, who's a television celebrity, this would be like nothing for her, but
Yeah.
I would fumble.
Well, it was a great week, a great
was.
evening, and just watching people receive the awards from their executive team, from their managers, it's just great. They walk a little taller when they head out. It's a great event.
It was a great evening.
All right, Gary, so let's get started with the numbers.
Okay, well, I'm in much better condition today in terms of my preparation for today's community engagement huddle. So I will go back to my traditional state report because I really, some interesting information just around case volume, positivity rates, but most interestingly around vaccinations. So I'll talk about that. So now at the state level, over the entire course of the pandemic, we have now performed 63.6 million COVID tests, of which 3.7 million or 5.8% were positive. But the 7-day positivity rate, so over these last 7 days, the people that are still being tested for COVID, the percentage that are testing positive has fallen all the way to 0.9%. So slightly less than 1% of those being tested are now testing positive. And it doesn't seem it was that long ago that, at least in Tulare County, we were over 20%. We're not quite where the state is from a county level, and I'll talk about that in a moment, but we're getting awfully close. That 0.9% translates into just 3 new cases per 100,000 population each day over the last 7 days. And when you look at the 33 million people that live in the state of California, that means across the entire state, we're averaging just 959 new cases per day. So that, again, one of the lowest levels we've seen. We obviously have suffered great sadness and loss of life over this pandemic. We have 61,555 Californians have died of COVID-related conditions, which translates into about 1.68% of those that contracted the virus eventually died of the virus. But our deaths per 100,000 now are down to 0.05 deaths per 100,000 population over the last 7 days, which is still a big number. it's still 42 people a day are dying of COVID in California. Now, obviously significantly lower than the thousands per day that we were experiencing back in December and January. But 42 deaths every single day in California for COVID is still too high, and we want to really see that number drop to zero. There have now been 35.1 million vaccine doses that have been administered in the state of California, and I think California has actually done a very good job compared to many other states in terms of really getting the message out there and getting folks vaccinated. So here's where it gets interesting. So California now has 15.9 million, or 47% of the population is now fully vaccinated. So 47%. With another 4.7 million, or 13.7%, that are partially vaccinated. So you add those two numbers together and you're at almost 61% of all Californians have at least had one dose of vaccine. So 47% of them fully vaccinated, which is either 2 doses of Pfizer or Moderna, or 1 dose of the Johnson & Johnson, but then another almost 14%. So that 60% is, it's good. Obviously it's lower than we would like, and there's still a lot of folks out there that are undecided or have decided that they're not going to get vaccinated. And that includes a lot of people that contracted the virus and have natural antibodies and don't feel that they need to get vaccinated. Now, the CDC has been recommending that even if you've had COVID, that you should still get vaccinated, and I know a lot of folks have done that. But when you take 61% that are vaccinated, plus some other percentage that are not vaccinated but contracted COVID and have the antibodies, we are approaching a percentage that is very likely close to that magic herd immunity, which is probably why we're seeing such a low number in terms of positivity rate and daily new cases.
How do we compare to other states?
I don't know. I haven't looked at that.
We want to win at something, right?
Yeah. Are Californians competitive?
Yeah, kind of.
Okay, so here's what I thought you would find interesting in terms of how's that distributed across age categories. So in terms of people that are 0 to 17 years old, only 3% of them have received a vaccine. Age 18 to 49, which is the highest category, just shy of 47% of folks that are 18 to 49 years old have been vaccinated. 50 years old to 64 years old, 25.8%, and those over age 65, 24.6%. It's actually next to children 0 to 17, which has really not been available to them, and it's just recently that they're allowing vaccinations for children 12 years and up, but that still leaves a lot of children in the 0 to 11 years. But if you exclude that age bracket, then the lowest vaccinated group of our population are those that are age 65 and older, which throughout this pandemic have been the population group that's been the hardest hit. 75% of all of our hospital COVID admissions were people that are age 65 and older. So I was shocked, frankly, to see such a low percentage of that age group that has been vaccinated. And once again, females leading males in terms of making the right decision, and it's always the female that is the health provider generally in the family. But 53% of women in California and 46.7% of males. Yes. Okay, so that's where we are at the state level. So at the county level, the county is no longer reporting how many tests they're actually conducting, so that data bit I don't have. But throughout Tulare County, throughout the entire pandemic, we now are just shy of 50,000 total COVID positive cases. We're at 49,931. But our 7-day positivity rate is down to 1.3%, so just a little bit higher than the 0.9% that California is reporting, and that's over the last 7 days. And if that was the only metric that determined what tier and color category we'd fall in, we would be in the least restrictive tier, tier 4 yellow. And then our health equity positivity rate, and again, that's the quartile of zip codes throughout the county that have some of the worst health factors. Their positivity rate is down to 0.8%. So as a county, we've done sounds like a pretty good job reaching into those communities and vaccinating, hopefully, and that's why their positivity rate is on the decline, but great to see that. The thing that's really kind of holding us back, and that measure would have put us in tier 4 yellow as well. The measure that's holding us back is our average number of daily new cases. So I mentioned earlier that the state is at 3.0 per new daily cases per 100,000. So is Tulare County. We're exactly at 3.0 daily cases. Unfortunately, we need to get that down to 2.0. So that's again per 100,000 people. So for a county with a population of 484,000, we'd have to be at or below 9.6 new daily cases over this 7-day period. And unfortunately, we're pretty consistently seeing anywhere from 20 to 40 daily new cases. So we're not even close. That number had actually dropped down to just barely above 2 a couple weeks ago, and now we've bounced back up to 3. So definitely the virus has not gone away in its entirety. It is declining, but we need to continue to see it further decline. There have been 842 total deaths throughout Tulare County, and that's almost identical in terms of the percentage. The state at 1.68, the county at 1.69 of those that contracted the virus and passed away from it. The Tulare County right now has 299 active cases. Again, 484,000 people in the county, and they only have 299 that they're still actively managing at this point. Now, I thought I'd share with you, so I talked about vaccinations at the state level. So let's talk about vaccinations then at the county level. So far, 33.5% of the entire Tulare County population has received at least one dose of vaccine. So the state is at 61% that have received at least one dose. 47% are fully vaccinated, plus another 13. So if you're fully vaccinated, obviously you've received at least one dose, you've received 2 doses. But 61% at the state level, 33.5% of Tulare County has been vaccinated. When we look at the age distribution, it actually almost mirrors the state. So that 0 to 17, we're at 2.4% have been vaccinated, which compares to 3% at the state level. The 18 to 49 age group is 46%, which is identical to the state. The 50 to 64 age category is 26.6 compared to the state's of 25.8. And the percentage of those age 65 and older in Tulare County that have been vaccinated is right at 25.0% compared to the state's 24.6%. So Tulare County is absolutely a mirror image of what we're seeing at the state level, and still, again, I guess I'm very surprised to see the age 65 and older only 25% being vaccinated, but perhaps that's also the population that contracted the virus in the greatest numbers and might have natural immunity, and they're choosing not to get vaccinated as well. So just some interesting factoids for today, and then I'll move quickly to where we are at Kauai. I'm always asked, how busy is the hospital? And we continue to be incredibly busy. Our occupancy rate this morning in the acute medical center was just shy of 91%. So we continue to hover in the very high 80s and low 90s. 10 of our 41 ICU beds are open. 12 of our 54 intermediate critical care beds are open. We had 10 medical surgical beds that are open. So still a little tight right now. But this is one of the important factors. We talked about that the governor has declared, so to speak, that come June 15th, if our positivity rates and vaccination rates continue to do well, and that hospitals have available beds, particularly in critical care areas, that those will be the triggers he's looking at to completely do away with the tiering, the blueprint for a safer economy, and essentially open up society and businesses to pre-pandemic levels. So we're a little less than a month away from that, and so we're going to obviously monitor it very closely. Great news within the medical center relative to COVID. We only have 10 COVID positive adult patients that are in the medical center right now. None of them are in the ICU, and none of them are on a ventilator. And we are seeing very positive results. It's interesting, some of these patients have stayed with us a very long time, months at a time. They're not ready, they're not strong enough, not able to breathe entirely on their own. When I say they're not on ventilators, often though they're on high flow oxygen. They have a nasal cannula. Sometimes they might be on BiPAP, which provides a little bit more oxygen support, but oftentimes it's the nasal cannula, and they're just not ready to be home alone. So, but I think things look very positive for these hospitalized patients. Often asked, how about employees? So we've had 1,181 employees, almost 1,200 of our 5,100 that contracted the virus since its beginning, but only 16 of our employees still remain out on a leave of absence that is COVID related. 11 of them have been out since before the beginning of the year. So we check in with them periodically, and some of them it's a long road to recovery.
Well, last week when we were serving out at West Campus, one of our employees came through the line that had actually been in the hospital 3 months.
Yes.
She almost died.
Yes.
And she was
Sylvia.
talking to us about her experience, and just she just felt blessed to even be alive. But she was still struggling.
Yes.
Working at a limited capacity, and that was a long road.
Absolutely.
Long road.
Yeah, and she definitely was one of the longer hospitalized patients, not just employees, but just patients in general, and then to have survived and to be back at work.
Yeah.
And every day she said, I'm getting a little bit stronger, but it's definitely, it's going to take a long time.
Yeah.
But we're so delighted that Sylvia is still with us.
Amazing.
Yeah. I think that's it.
Well, let's jump back up to the vaccine. So a community member wants to know if there are any news on the boosters, because there are reports that say the vaccine immunity lasts for 6 months. We're approaching that 6 months. So have you heard anything about boosters?
Yeah, in fact, I was reading a couple articles just before coming over here. I try to read as many positive articles as I can, and this one was definitely more negative. I mean, it was more of a warning, particularly, us in the room here as healthcare workers, we were vaccinated back in December, and here it is approaching June. there's not a lot of data out there on how long immunity from the vaccine lasts. Scientists believe that immunity that is obtained through actually contracting the virus has a life of about 6 to 8 months. They think there's no reason to believe that immunity from the vaccine won't similarly last 6 to 8 months, but as you just said, we're approaching that 6-month mark. And so this article was, talking about that by fall, our immunity may have dissipated or could be gone entirely. They talked about there are a number of drug manufacturers, Pfizer, Moderna, AstraZeneca, Johnson & Johnson, all studying booster shots now, and whether it's an actual shot or is it a nasal mist, because that's where the virus starts in your nose, it colonizes and then spreads to your lungs, and will it become just part of the annual flu shot, which we generally get September, October, which might be the time where we'd be thinking that this vaccine would be diminishing, and so they were kind of preparing us mentally that we either we're going to get a whole new set of vaccine shots, get 2 again in whether it's Pfizer or Moderna, or do we now just annually get a booster shot just to reignite the immune response that we got from that first vaccination. So nothing definitive there. I don't think there's any booster shot. There clearly is not a booster shot that's been approved yet for emergency use authorization by the FDA. But I would imagine that these scientific studies are taking place and may actually have formal studies, where they're using actual subjects.
Well, there have been people in studies since last March.
Yeah, they continue to follow.
Yeah.
So.
Yeah, that'll be very interesting. It's kind of interesting. How do you feel about them opening up the vaccine to kids?
Well, I think about the flu vaccine.
Yeah.
I mean, we vaccinate infants. We vaccinate toddlers for the flu because unfortunately, the flu every year hits young children and elderly adults the hardest. We have many young children that die of the flu every year, and we know that schools are an incredible breeding ground for the flu. You see outbreaks in elementary schools and middle schools and high schools, and they bring it home and infect their families. Now, obviously, COVID and the flu have been behaving quite differently in children. Most indications are that children aren't immune from getting it, but if they get it, they have a much more mild reaction to it. They tend to be very asymptomatic. There have been very, very few young people, 17 and younger, that have died over the course of this pandemic. But then we look at a country like India, where they are having an incredible surge, 500,000 people a day contracting the virus, thousands, tens of thousands dying every day, and it is infecting a lot more younger people, all the way down 26 years old, perhaps even younger, that there's this double variant that is formed in India and now is predicted to spread to the United Kingdom very quickly, and then very well could come to the United States. So my personal feelings on vaccinating children, I don't know. I frankly haven't given it a tremendous amount of thought. I think I've shared that my daughter, who's a healthcare worker, she just turned 29. Both she and her husband got vaccinated, but her twin brother, my son, and his 29-year-old wife have chosen not to get vaccinated. So now they're not children anymore, but they're still in that young adult population.
They're still in the childbearing. Both of my daughters got it, and just in the back of my head, I'm just like, okay,
I
Okay,
know,
we're
and
okay.
that's
It's okay.
why my daughter-in-law really doesn't want to get vaccinated.
Right.
They want to have children, and they want to have them pretty soon. And
Mm-hmm.
even though the American College of Obstetricians came out very early in the pandemic, highly encouraging, pregnant women and women of childbearing age to get vaccinated. And we've seen a lot of pregnant women
Yeah.
come to Kuya with COVID.
Right.
Yes.
Right, yeah. Okay, so let's move on to the changes that we're making due to the lower numbers. Are we going to open up our facility to pre-pandemic access for our visitors and family?
We will eventually, but not yet. So we all follow, the CDC and what's going on there, and obviously last week, great, wonderful, revolutionary news came out that if you're fully vaccinated, then you don't have to wear a mask indoors or outdoors, and
And we were so excited.
we were very
so
excited, yes. But that doesn't apply to healthcare settings. That does not apply to hospitals or doctors' offices or skilled nursing facilities. So we can't do that. And not just because the CDC carved out healthcare institutions, but we in California also have to follow OSHA. And OSHA, sets the safety standards for businesses, including hospitals. So the CDC has come out and said healthcare workers who are fully vaccinated can gather together in break rooms or meeting rooms and remove their masks. But OSHA says no, you can't do that. So even though the CDC would allow us to do it in the hospital, OSHA wouldn't. And we answer to OSHA. OSHA is actually the enforcement agency that can come in and fine us, cite us, shut us down in certain areas. So CDC are guidelines. OSHA are rules and regulations. So we still have to screen visitors that come in. We still have to wear masks at all times. We don't have to wear N95 masks anymore if you're taking care of non-COVID patients, but you still have to wear a surgical mask. And so for those reasons, we're still keeping our visitor restrictions somewhat in place. We do have plans to increase visitors to 2 at a time for every patient. The hours will stay the same, but we are also going to allow unlimited rotation. So a patient could have 20 different visitors in a single day, but only 2 at the bedside at any time. So that's a pretty big change. But because we have to continue to screen, and not only screen but track, so we have to actually log in every visitor by name, the patient they're seeing, what room they're in. So we have to know every single visitor that is in the hospital and where they are in the hospital at all times. And so you can imagine that if we still have to screen and log, that we're going to have to, and we want to open it up to more people where you can again have 10 to 20. We need to acquire monitoring software or have more people do that. So we're still waiting. Again, we're going to follow the CDC, and when they become less restrictive with hospitals, when OSHA allows us to be less restrictive, then I think you'll see continued changes.
Yeah.
I don't think we're going to go back to pre-pandemic levels, though. I think this has given us an opportunity just to kind of reevaluate. We love visitors. Patients love visitors. It's an important part of the healing process and communication among the healthcare team. But we also need patients to get rest, and we need staff to be able to do their uninterrupted work.
Right.
And so it's that balance. And we found in certain areas that maybe a few less visitors, a little less visitation is actually better for the patient. So that will be part of that evaluation process.
Yeah. So what about when people come in and they have to go through our screening and they say, I'm vaccinated?
they still have to, again, that relaxation of those rules don't apply in a hospital setting. So we still have to screen them, take their temperature, ask them the questions. They still have to wear a mask at all times.
Even at Lifestyles.
Yes, although
That's tough. Yeah.
Yes, and I will tell you that the membership at the Lifestyle Center, they're doing a great job abiding by that. We are allowing, if you're doing an aerobic exercise, you can remove your mask. So that is pretty uniform. But when you're done with that exercise, if you're weightlifting or stretching or doing other things, then you have to wear that mask. And I think our staff are doing a good job making certain people are following those rules. But members are also doing well in
Right.
disciplining themselves.
Yeah. Okay, so valet parking, when is that going to become available again for our
So
family?
it is available. Yeah, it actually has never gone away. Now, the use of valet parking has changed dramatically. And that's because the entrance into the hospital really shifted to the Asequia wing, where that's where you pretty much have to come in as a visitor so we can control the screening. We don't have valet service at the Asequia wing entrance.
Are we going to move valet service?
Well,
Oh.
yeah, I'll get there.
Wait, Deborah.
Yes.
Wait.
So
He's
wait,
got-
yes.
Yeah.
So valet parking's always been at the Mineral King wing entrance, and that was shut down for a while. It has opened back up, but we used to actually park 200 cars a day. We're now down to 40.
Oh.
So we have such, little traffic going in and out of that Mineral King entrance. Although I don't even know if traffic can go in and out, but people can valet park and then walk around to the Asequia wing. You can do that, but it's obviously a little bit of a trek.
Yeah.
But you can pull right up to the Mineral King wing entrance, valet park your car, and then walk around the east side of the building into the Asequia wing entrance. So right now, valet parking is available 8 a.m. to 9 p.m. Monday through Friday, 8 a.m. to 6 p.m. on the weekend. So we also now have a larger parking lot. Now that Zone 5 of the emergency department's been completed, all the construction is now gone, that east parking lot is now larger. It's opened up, which may mean that we don't have as many cars that need to be parked by valet, that visitors can self-park. So we'll reevaluate that. We are looking potentially at bringing valet service to the Asequia wing. It would come at a cost of about $25,000 a month. So you're talking $250,000 a year to add valet parking to the Asequia wing. There's also a lot of logistical issues there about where would we park the valet cars. The parking garage across the street is probably not going to work. There's just not, unlike the Mineral King wing where they park over at what we call the Fragolti Black space and they run back and forth, we don't have that place off the Asequia wing. So even if we felt we could afford to do it, we may not logistically be able to do it.
Interesting. Okay, and so isn't California still under the mask mandate?
They are.
They are, but the
Yes.
CDC coming out and saying that has given people renewed rebellion. And that's probably not a good word to use because people are now walking into stores without masks. I feel like it's
Right.
lightened up a lot.
Oh, it has.
Yeah.
It has. And definitely, restaurants
Yeah.
have opened up significantly and not requiring mask wearing while you're at your table and stuff.
Yeah.
But we just stopped at Save Mart last night on the way home, and they still have mask required signs on the doors. All the clerks are wearing masks. I wore my mask, but clearly half the people in there
We're not, yeah.
were not wearing masks, did not have it draped over their ears or down around their chin. They just did not have a mask, and I didn't really see any enforcement going on. So, yeah.
All right, so let's move on. What is the status of our ED?
Okay, so you're speaking specifically about Zone 5,
Yes.
because Zone 4 and 6, which were part of the 2-year, 3-phase expansion, are fully opened and seeing patients. But Zone 5, the major expansion that added 24 new exam rooms and 100 plus waiting room capacity, or lobby is what we call it. So we've had our full inspection by the California Department of Public Health. They were here about 3 weeks ago, found some minor items that have all been fixed, and we were fully expecting that it would be open by now. But we've been waiting and waiting and waiting, and finally this last week we were contacted by the director of the Bakersfield field office of CDPH, which is, we report to the Bakersfield office. And they started asking a lot of questions around our staffing plan. So as part of our licensing application, you have to provide to them a staffing plan in terms of how many physicians, advanced practice providers, nurses, techs, who is going to staff that additional space. And it has to be, acceptable to them, that they believe that the number of staff you're going to assign to that area, that you do in fact have them, that they're available, that they're sufficient to cover the physical space, and they are sufficient to cover the patient volumes that you're expecting. We think that we have provided them a very appropriate staffing plan, but they are still evaluating it, and we're, again, waiting to hear from them any day. So we are getting a bit frustrated, although the ED, again, continues to be pretty busy. We've hit days of 250 plus visits, and we would have loved to have those 24 beds in that additional waiting room. So I know our staff and our providers are very anxious.
Yeah, it's like having a new house you can't move into.
Yes.
Waiting for that certificate of occupancy.
Waiting for escrow to
Yes,
finally close,
yes,
huh?
man.
Yeah.
Okay, so we are now in the middle of May, and April financials have been released.
Yes.
So, good, bad, ugly?
So-so. Not as good as March. So March was the first month that we actually achieved a positive operating margin without the need for any stimulus funds. So that was the first month of that kind since December of 2019. Unfortunately, our numbers did fall in the month of April. So for the month, Kauai Health posted a net operating loss of a little more than $1 million, so $1,033,000. But that's before recognizing any federal or county stimulus funds. So those are still trickling in. And after considering the amount of federal stimulus funds and county funds that came in related to the month of April, that operating loss dropped down to $113,000. So it was still a loss for the month, but again, of all the months that we experienced losses throughout the pandemic, it probably was one of the lowest, if not the lowest. So closer and closer to break even. So year to date now, we're 10 months into our fiscal year that started on July 1st. And so before considering stimulus funds, we have a cumulative operating loss of $29.1 million, which is awful. Fortunately, and bless our federal government, bless the Tulare County Health and Human Services Agency for all of their support, the County Board of Supervisors, thank you Amy and Pete and all of them, that when you take into account the stimulus funds that have been received over that 10-month period, we actually turn from this big operating loss into a $1.5 million positive operating margin. So we are in the black, not in the red, for that 10-month period, but only because of those stimulus funds that are drying up. So you might remember that our budget for the year was to end the 12 months essentially with a break-even operating margin, 0. So that our operating revenue would be exactly equal to our operating expenses, and we would break even for the year. So we've got a $1.5 million cushion kind of through April with just 2 months left, May and June. And so we're remaining hopeful that even though we won't probably have any stimulus funds, the fact that surgery has completely reopened, outpatient volume starting to pick up again, the medical center still remains busy. We're feeling more positive than not that we'll finish the year having at least achieved that zero break-even position. So, so that's really, really good. Our patient volumes, they remain high. For the month of April, our patient revenue actually was more than $2 million over budget. But our labor costs were very, very high. They were $4.5 million over budget. So we're still using quite a bit of travelers. Overtime has really come down. I think we paid out something like $50,000 the last pay period in extra shift bonuses. That compares to $400,000 per pay period that we were paying during the height of the pandemic. So that's coming down. But we also, unfortunately, we had 3 or 4 claims under our self-insured employee health plan. So we don't go out for our own employees and purchase like Blue Cross or Blue Shield or Aetna, commercial insurance like many employers do. As a hospital where we can actually provide the vast majority of health care directly to our employees and at only the actual cost of providing the care, a lot of hospitals of our size self-insure. So we're the health plan. And unfortunately, we had 3 or 4 of employees or their covered dependents that had multi-million-dollar hospital bills at other hospitals. So unfortunately, they might be suffering a catastrophic illness, a disease, an injury that they've had to go to Stanford or Cedars or UCSF. And when they go there, we write the check to those hospitals. Wow. So we do have reinsurance, but it has to hit $1 million before it kicks in, and we start getting. So we're responsible for the first $1 million of expense, and then the insurance carrier steps in and starts covering anything in excess of that. But when you get hit with 3 or 4 claims in a single month, it causes us to be, I think, about $3 million over budget in our employee health costs for the month. So that's unusual. We don't generally see that, and we'll have big claims. With 5,100 employees and a couple thousand covered dependents, I think we have 8,000 participants in our plan. You're going to have some very large claims, but they tend to be kind of spread out rather than all hitting in the same month.
Wow. Okay, well, kind of negative, kind of positive.
Yeah,
so.
I would say, close to break even. I'm happy.
That's good,
April only has 30 days, so that's 1 day less of revenue in a 31-day month, and we generate almost $2 million a day in revenue. So, but a lot of your expenses are still a full month, even though you have only have 1 less day of revenue. So April traditionally is not a great month. So May we got a 31-day month, but then June another 30-day month. So I tell people, cross your fingers, cross your toes, and
I never really look at it that way. So yeah.
Okay,
so we have a chat. So are you telling me that if an elderly person self-parks in the Mineral King parking lot that is now open by the ED, they have to walk around either the ambulance bay or the hospital to enter through the Asequia wing entrance?
I don't think so, because I believe we have electric carts that we transport patients. So I'll need to get back.
So your valet people would then transport?
Well, I know that we have like a golf cart, the longer extended ones that carry more passengers. And I believe that they are transporting people that if you self-park in the Mineral King Wing or you valet park in the Mineral King Wing, that we take them with that golf cart shuttle and bring them over to the Acequia Wing to come in through the screening.
Okay.
So,
So we don't have the screeners at Mineral.
I don't think so.
Okay.
Yeah, I wasn't ready for that one yet.
Okay.
So
We'll find out.
It's moving. Yeah,
Yeah,
it's
yeah.
a moving target. So let's find out, and we'll post that out on the written transcript.
Because the quickest way would be to go through the ambulance bay, but that could be potentially dangerous.
Yeah.
If you're in the ambulance bay.
Yeah, and it also, it depends on who you're coming to visit.
Right.
Because if you're coming to visit, somebody that's just delivered a baby or is having a cardiac procedure, that's in the Acequia Wing. So you'd want to park in the garage across the street or in the parking lot right outside the entrance and come in through the Acequia Wing. But if you're coming to see somebody on 2 South or 3 North or 4 North, the quickest way is to come through the Mineral King Wing.
Yeah.
So yeah, let us check it out.
Right.
I want to make certain we give good information.
Right. Okay, so if someone parks in the Mineral King Wing, we ask where they are going. If it's the Acequia, we suggest they park on the other side, or we will drive them there in a cart. Thank you for that.
Perfect.
Okay, perfect.
Okay.
All right, Gary, well, we are down to the end of our questions and
Wow,
our
how are we
comments.
on time? 9 minutes to
we're-
go,
We're
yeah.
on time, and so do you have anything else you'd like to add? We rebranded. So how many times have you accidentally said Kauai Delta?
Not as many as you.
I was on a group this morning and I was bragging about our rebranding, and while I was telling them about it, I said Kauai Delta like 10 times and had to
Yeah.
keep saying, so sorry, Kauai Health, Kauai Health, Kauai
Yeah.
Health.
No,
It's great.
Yeah, you have to concentrate.
Yes,
There's no doubt about
yes.
it. But it has been really good. I tell you, I've had nothing but really overwhelming support. People have been really excited about it. When you get the opportunity to tell the story behind it and why we did it and how long we've been thinking about it and working on it, I think people, wow, that makes a lot of sense.
Yeah.
And so people tease me too a lot. Whenever they see me, they oh, Kauai Health, which is funny.
Well, somebody said, it seemed like it just happened overnight. And I said, well, it may have seemed that way, but we've
Right.
been
Oh
working
my
on it
gosh,
for several years.
Yeah, we've been working on it for a very long time. But generally, when companies change their brand and their logo and their look, they try to do it with the big bang.
Yeah.
And not do the slow rollout. But we're kind of somewhere in between there. We did want to do the kind of the big bang announcement, but then we're also being incredibly cost conscious. So we're just slowly rolling it out so that we can do it in smaller bites and less expensive. But
Yeah. Very exciting. Okay.
yeah, but just again, thank you to all of you for tuning in today. Thank you for your great questions. Keep them coming. We'll continue to use this as a vehicle to keep you well informed, timely informed. We want our ambassadors and our community advisory committee members to be the first to know. You may have seen, I haven't read the Times Delta, had a 6 a.m. meeting this morning with doctors, so the paper wasn't delivered yet to my house. But I understand there might be a front page article about Kauai Health and some of the good grades that we earned relative to patient safety and quality, and being recognized again by Health Grades as one of the best 250 hospitals in the country for the 3rd year in a row, and one of the best top 50 cardiac surgery programs for 4 years in a row. We also received more awards from Health Grades than any other hospital in the Central Valley in a lot of different areas, stroke and cardiovascular, neurosciences. So just some phenomenal work being provided here by our doctors and our nurses and the entire healthcare team. So thank you for being spokespeople for us and getting the word out there. And as we say, we want to be the source of truth when it comes to healthcare matters for our county. And you're a very important vehicle where we're able to communicate that truth. So thank you for continuing to stay with us, and we'll see you in a couple weeks.